Hello friends, I'm Dr. Sapna Roshni. I'm an aesthetic and plastic surgeon. My forte is in the field of cosmetic surgery over the last 20 years. Today let's discuss something about what happens to females post-pregnancy and lactation. The price that we pay for the bundles of joy that we have. During pregnancy and lactation, due to the hormonal changes, we females undergo a lot of changes on our body, mainly pertaining to the breast and the abdomen. There's a lot of changes on the abdomen because of the increasing size of the fetus and our abdomen distance, leaving behind a lot of saggy tissue, a lot of stretch marks and whatnot, fat and so many other things on the abdomen. The breast also becomes enlarged, they may become saggy and they lose their tone and their firmness. Even the female genitalia undergoes a lot of changes. Can we get back to shape and be what we were before our pregnancy and lactation? Yes, definitely we can. Probably you have heard of the term mommy makeover. What does it pertain to? It is definitely a series of body contouring procedures that we do as a part of cosmetic surgical procedure, which depending on what the person needs, we can do on the breast, on the abdomen, on the thigh or any part of the body where we have a lot of changes happened after pregnancy and lactation. Mainly, females focus on the breast and the abdomen. If your breast has become very saggy and has lost its tone, you can do a breast lift, which we call as Mastopexy. Or if you feel it's not so saggy, you just want an increase in the volume, you can go in for a procedure which is known as breast augmentation, which can be done probably if a moderate size increase is desired. You can go in for injection of fat, whereby you take fat from somewhere where you have excess of fat by procedure called liposuction and you can inject it on the breast, or you can go in for silicone breast implants, which is a foreign body, but the feel in the case of silicone breast implants is much better. If you go in for fat transfer, you get only a moderate increase in size. Sometimes the breast may go disproportionately large in size. In that case, you can go for a reduction mammoplasty, whereby you reduce the size of your breast which is enlarged. Also, you get a simultaneous lift for the breast where the nipple areola complex is lifted up to an ideal youthful position. Then coming to the abdomen, if your abdomen has a lot of fat, let's say it's become very saggy, it is a lot of stretch marks, then you can go in for an abdominoplasty procedure, which in layman's term you call a tummy tuck procedure. So the excess fat, the skin and the loose tissue from below your belly button can be removed and your skin can be tightened. The muscles which have become lax during your pregnancy, that can also be tightened. So this procedure is called an abdominoplasty. If you don't have much of changes happening to your abdomen, but you have an excess of fat, let's say in different parts of your body, it may be the thighs where you have the saddlebags on the sides, or it may be the love handles on your flanks, then you can remove all these things by a procedure which is known as liposuction, where you just suck out the excess fat. Sometimes females also want to undergo changes in the female genitalia. Your vagina would have become lax. You can go in for a tightening procedure whereby you tighten the loosened vagina, or your private parts like the labia and the majora which have become, let's say, loose. You want to do a procedures related to that. There are many procedures whereby we can enhance the look of your female genitalia also. Now the term the designer vagina is becoming more and more popular. So in total, what we do in mommy makeover is a maternal restoration body contouring procedure, whereby we do a multitude of these procedures. It can be in one session or it can be split into 2 sessions depending on the number of procedures that we want, so that we can keep the anesthesia time much lesser. So these are all procedures which are done under general anesthesia. Depending on the desire of the female, we can include or exclude whatever procedure we want or we do not want. You will probably have to stay 1 night in the hospital. Then you are back to work. It will take roughly around 2 to 3 weeks to be back to your normal schedule. But It is a very good it is very good to know that we have all these procedures which you can do and be back to what you were in your pre-pregnancy state. So overall, I would say all females, we all have the desire to be looking our best, what we were before we had our babies, to improve our breast shape, to improve the look of our abdomen, our thighs, any part of your body. So nowadays, a lot of females are coming in for these procedures, and I would say that no female should be hesitant to go in for these procedures if you overall want to maintain your look. Thank you so much.